Hong Kong has been struggling to contain the spread of COVID-19, even as many parts of the world are returning to normalcy.
It's ridiculous. It feels like we're in the third world. I never thought something like this would happen to an international financial hub.
For more than 6 months, Hong Kong saw 0 imported COVID-19 cases. But since the Lunar New Year, the highly transmissible Omicron variant has led to an exponential growth in the caseload, with clusters developing throughout the city.
I think the biggest issue here is that they didn't do well in their preventive measures. They didn't close the borders, and now all these cases have come through.
Hong Kong's Chief Executive Carrie Lam announced this week tougher measures to stop the spread.
We will implement compulsory universal testing, or in English, CUT, within 3 months in order to cut off this transmission chain.
The Hong Kong Security Bureau has also set up a new anti-epidemic police task force to prepare for mandatory testing for the entire city. Hong Kong aims to follow Beijing's approach by implementing a dynamic zero COVID-19 infection strategy. There are designated clinics to take in COVID-19 patients with mild symptoms to ease the strain in public hospitals, having reached maximum capacity. The Hong Kong government is also looking to build makeshift hospitals for COVID-19 patients, but some residents say the measures will not be enough.
I think there is a need to strengthen the preventive measures and increase citizens' awareness, but I don't think we can achieve zero COVID-19 because we live in such a densely populated environment, and so unlike on the mainland, where they have much more space to carry out those measures such as quarantine.
The government has introduced a vaccine pass, which will require citizens to provide their vaccination records before entering designated venues, such as shopping malls and wet markets. But not everyone in Hong Kong supports tougher COVID prevention policies.
I don't support the government in introducing stricter measures because we have our freedom and rights. Even forcing us to take vaccines is already not quite acceptable.
Family practice doctor David Owens says it's unrealistic at this stage to completely eliminate COVID from Hong Kong.
We're mostly going to get infected. Most of the people in Hong Kong are going to be infected in the next 3 months. And so really what we have to do over the next 2 months is to focus on minimizing the harm to the health system.
Health authorities have started offering the Chinese Sinovac vaccine to children as young as 3 years old. Hong Kong currently has a vaccination rate of over 76%, but only about 20% of those aged 3 to 11 have received their first shot. Elizabeth Lee, VOA News.